Every morning, countless Americans open their eyes, start their routine, and assume their body is working for them, when in reality, a vital system may already be quietly breaking down without pain, without noise, and without mercy. This is exactly what makes a situation so dangerous you don't feel the damage while it's happening. And by the time your body finally speaks up, the consequences are often permanent. As a physician, I've watched patients sit across from me in total disbelief, hearing for the first time that years of silent strain have already pushed their health to a tipping point. No dramatic symptoms, no obvious warning, just lab numbers that suddenly no longer lie. And what's even more alarming is this: many of these people were following healthy advice they were told would protect them. I'm Dr. Johnny, and today I need your full attention because what I'm about to explain could change how you think about your daily choices forever. In this video, I'll reveal what's really happening inside your body, why traditional advice often fails, and the clear science-backed steps you can start using now to protect your health before silent damage turns into irreversible loss. Most people don't realize this, but the traditional kidney diet many patients are taught to follow is quietly making their condition worse, not better. From the very first diagnosis, people are drilled with fear-based rules: avoid protein at all costs, stay away from anything with potassium, and eat as little as possible just to be safe. On the surface, this sounds protective. In reality, it creates a dangerous chain reaction inside the body that accelerates decline rather than slowing it down. I remember a patient in his early 60s who followed every rule perfectly. He cut his protein to the bare minimum, removed fruits and vegetables completely, and lived on white rice toast and a few safe foods. On paper, he was compliant. But within months, his energy collapsed. His muscles visibly shrank. His blood sugar climbed despite eating less. And his kidney function, it kept declining. What failed him wasn't discipline, it was the strategy itself. Science explains why this happens. When protein intake drops too low, the body begins breaking down muscle tissue to survive. This loss of muscle doesn't just weaken the body, it disrupts glucose metabolism. Studies show that reduced muscle mass increases insulin resistance, which drives blood sugar higher. And uncontrolled blood sugar is one of the fastest ways to worsen kidney damage. In other words, the very diet meant to protect the kidneys often ends up increasing the metabolic stress placed on them. The same pattern appears with extreme restriction overall. Eating too little doesn't give the kidneys a break, it forces the body into a stress state. Stress hormones rise, inflammation increases, and the kidneys are asked to filter a bloodstream that is now more toxic, not less. Clinical data consistently shows that malnutrition in chronic kidney disease is associated with faster progression, higher hospitalization rates, and increased mortality. This isn't about opinion, it's measurable biology. And here's the most dangerous part: fear disguises itself as discipline. Patients believe they are being responsible by eating less, avoiding more foods, and shrinking their diet down to what feels safe. But safety without balance becomes damage. Eating the wrong way out of fear is far more dangerous than eating enough when it's done correctly. The real goal is not to starve the kidneys. It's to reduce unnecessary workload while preserving muscle, stabilizing blood sugar, and lowering inflammation. That requires a smarter approach, not a smaller plate. Once you understand this, the entire concept of a kidney diet begins to change from restriction to strategy. But understanding that traditional kidney diets fail is only the first step. Because if protein and potassium aren't the real enemies, then what is? There's another hidden factor, far more dangerous, that most people consume every single day without realizing it. And that's what we need to talk about next. Once people let go of the fear that protein and whole foods are automatically destroying their kidneys, a much more uncomfortable truth begins to surface. The real damage is often coming from the very foods labeled as safe or even healthy. This is where most kidney advice completely collapses because patients are taught to avoid the wrong enemies while unknowingly consuming the most dangerous one of all. I've seen this pattern repeatedly. A patient proudly tells me they've cut back on meat, stopped eating fruit, and switched to low-fat packaged foods recommended by friends or online kidney forums. They point to protein bars, plant-based deli slices, non-dairy creamers, and heart-healthy frozen meals as proof they're doing better. But their lab results tell a very different story: rising phosphorus levels, worsening vascular stiffness and kidney function, declining faster than expected. The problem isn't what they removed, it's what quietly replaced it. The true culprit is phosphate additives, inorganic phosphorus compounds added to processed foods to improve shelf life, texture, and flavor. Unlike natural phosphorus found in whole foods, these additives are absorbed almost completely by the body, often at rates close to 90–100%. Your kidneys don't get a choice. They must filter it all. And over time, that overload accelerates kidney damage and hardens blood vessels, increasing the risk of heart disease. The #1 cause of death in people with chronic kidney disease. Here's the shocking part. Phosphate additives are rarely listed clearly on nutrition labels. You won't see the word phosphorus highlighted. Instead, they hide behind names like phosphoric acid sodium, phosphate calcium phosphate, or anything ending in phos. Studies have shown that patients consuming high levels of these additives experience faster CKD progression and higher mortality compared to those eating similar calories from whole foods. This isn't about eating more, it's about absorbing more of the wrong thing. Meanwhile, the foods people are terrified of, whole fruits, natural proteins, minimally processed meals, often contain organic phosphorus that is absorbed at much lower rates, especially when paired with fiber. In other words, the body handles these foods more gently. The irony is, painful people avoid an apple out of fear, but consume a kidney-friendly processed snack that quietly overloads their system. The solution isn't complicated, but it does require a mindset shift. Stop outsourcing your food choices to marketing labels. Start prioritizing foods with short ingredient lists, recognizable ingredients, and minimal processing. When in doubt, whole foods beat healthy packaging every time. Reducing phosphate additives alone has been shown to lower serum phosphorus and ease kidney workload without extreme restriction. And this is the turning point. Once you remove the real villain, everything else starts to make more sense. But here's where most people still get stuck. Even with better food choices, they follow one-size-fits-all rules that were never designed for their body. Because knowing what to avoid isn't enough. The next question is far more important. How do you know what actually works for your kidneys? And that's exactly what we need to uncover next. Once people remove the real dietary villains, another hard truth quickly comes into focus. There is no such thing as a single kidney diet that works for everyone. Yet online social media and even well-meaning advice groups keep pushing the same rigid rules, as if every kidney, every lab result, and every body operates the same way. This one-size-fits-all approach doesn't just fail, it actively misleads. I once worked with 2 patients who followed the exact same kidney meal plan they found online. On paper, they looked identical. In reality, their bodies told completely different stories. One had stable potassium levels and moderate kidney decline. The other had borderline hyperkalemia and heavy protein loss in the urine. Yet both were told to eat the same foods, avoid the same nutrients, and follow the same restrictions. Within months, one improved. The other worsened. The diet wasn't wrong, it was mismatched. Kidney health is deeply personal because kidney disease is not a single condition. What actually matters are your numbers. eGFR tells us how well your kidneys are filtering albumin in the urine, reveals ongoing damage, blood potassium, and phosphorus. Show how your body is handling minerals and medications can dramatically change how nutrients are processed. For example, a patient on ACE inhibitors may tolerate potassium very differently than someone who isn't. Ignoring these variables is like prescribing the same medication dose to every patient, regardless of weight or age. Research consistently supports this. Studies show that individualized dietary interventions based on lab markers slow CKD progression more effectively than standardized diet plans. Patients whose diets are adjusted according to eGFR and albuminuria experience better metabolic control, fewer electrolyte imbalances, and lower hospitalization rates. In contrast, generic kidney diets increase the risk of malnutrition and unnecessary restriction, 2 factors strongly linked to worse outcomes. The real solution is not complexity, it's precision. A functional kidney diet adapts as your labs change. It evolves with your medications. It responds to your stage of disease instead of fighting against it. This means some people need more protein, not less. Some can safely eat potassium-rich foods. Others need temporary limits, not lifelong bans. Strategy replaces fear. This shift is empowering. Once patients understand that their diet should be built around their own data, not internet rules, compliance improves and anxiety drops. Food stops feeling like a threat and starts becoming a tool again, something that supports healing rather than accelerates damage. But personalization alone still isn't enough, because even with the right framework, one nutrient continues to terrify patients more than any other, and it's often misunderstood in the most damaging way. Knowing your numbers changes everything, but there's still one major fear we need to dismantle next, and it starts with protein. Protein has been framed as the ultimate villain in kidney disease for decades, and that fear has done more harm than most people realize. Patients hear the word protein and immediately think damage overload failure, so they slash it aggressively sometimes to levels their body simply cannot sustain. What follows isn't protection, it's a slow metabolic collapse that quietly accelerates kidney decline. I've seen this fear play out again and again. One patient told me, "I'm scared to eat eggs or fish because I don't want to hurt my kidneys." At the same time, his legs were weakening, his grip strength was fading, and he felt exhausted walking short distances. His labs revealed the real issue: muscle loss, rising insulin resistance, and worsening inflammation. He wasn't eating too much protein, he was eating too little of the right kind. Science is very clear on this point. When protein intake drops below a critical threshold, the body breaks down skeletal muscle to survive. That muscle loss reduces glucose uptake, leading to insulin resistance and higher blood sugar levels. Elevated blood sugar damages the tiny blood vessels in the kidneys, increasing pressure inside the nephrons. Multiple studies show that low muscle mass in CKD patients is associated with faster disease progression, higher hospitalization rates, and increased mortality. The irony is brutal. Avoiding protein to save the kidneys often speeds up the damage. The real issue isn't protein itself, it's how and what kind. Excessive amounts of poorly chosen protein can increase nitrogen waste. But moderate, well-distributed protein from high-quality sources helps preserve muscle-stabilized metabolism and reduce overall stress on the kidneys. Research comparing protein sources shows that plant-based proteins and certain lean animal proteins produce fewer uremic toxins and less inflammatory burden than highly processed options. This is where strategy replaces fear. Instead of cutting protein indiscriminately, the focus shifts to balance adequate intake spread across the day, paired with fiber-rich foods and matched to kidney function and lab values. Patients who follow this approach maintain strength, improve insulin sensitivity, and often experience slower declines in eGFR. Protein becomes a tool, not a threat. Here's the mental shift that changes everything. Muscles are not optional organs. They are metabolic buffers that protect the kidneys by stabilizing blood sugar and reducing systemic inflammation. When you protect muscle, you protect kidney function indirectly but powerfully. This is why patients who eat enough of the right protein often do better than those who eat the least. And once this fear begins to dissolve, another long-standing myth starts to crack, one that causes people to avoid some of the most protective foods available to them. Because understanding protein correctly still isn't enough. There's another nutrient people fear even more, and avoiding it unnecessarily may be silently making kidney disease worse. Potassium has become one of the most feared words in kidney disease, and for many patients that fear is completely misplaced. The moment someone hears CKD, fruits and vegetables are often the first things they cut out. Bananas disappear, greens vanish, plates become beige, processed, and nutritionally empty. What's rarely explained is this: chronic kidney disease does not automatically mean you must avoid potassium, and doing so without a real reason can quietly accelerate damage. I've worked with patients who proudly told me they hadn't touched fruit in years because they were protecting their kidneys. Yet their labs showed worsening blood pressure, rising inflammation markers, unstable blood sugar, and progressive kidney decline. When we reviewed their potassium levels, they were completely normal. The problem wasn't excess potassium, it was the absence of protective plant foods. Here's what science actually shows. Potassium from whole foods behaves very differently from potassium in supplements or additives. Fruits and vegetables come packaged with fiber, antioxidants, magnesium, and organic acids that reduce metabolic acidosis, improve insulin sensitivity, and lower blood pressure, all major drivers of kidney damage. Large observational studies consistently show that CKD patients with normal potassium levels who consume more fruits and vegetables have slower eGFR decline and lower mortality than those who avoid them. The danger of blanket potassium restriction is that it strips away these benefits. Fiber feeds gut bacteria that reduce uremic toxins. Plant antioxidants lower oxidative stress inside the kidney's microvasculature. Natural potassium intake helps relax blood vessels, reducing intraglomerular pressure. When patients unnecessarily restrict potassium-rich foods, they often replace them with refined carbs and processed low-potassium products, which spike blood sugar, worsen insulin resistance, and increase phosphate exposure. Of course, potassium does matter, but context matters more. If blood potassium is elevated, if certain medications are in play, or if kidney function has declined beyond a specific threshold, adjustments are necessary. But adjustment is not elimination. Portion size, food preparation methods, and food selection make a massive difference. Techniques like leaching vegetables, spreading potassium intake across meals, and prioritizing lower potassium produce can allow patients to keep plant foods in their diet safely. This is where fear-based advice fails people. Instead of teaching nuance, the message becomes avoid potassium, and patients obey even when it harms them. The truth is far more empowering. Potassium is a marker to monitor, not a nutrient to demonize. When labs allow fruits and vegetables are not enemies of the kidney, they are allies. Once patients reintroduce plant foods appropriately, we often see improvements that feel almost paradoxical. Better blood sugar control, lower blood pressure, improved energy, and more stable kidney labs. The kidneys are not struggling because of potassium, they're struggling because of inflammation, metabolic stress, and poor dietary quality. But even this realization isn't the full picture, because choosing the right nutrients still isn't enough if the overall food system is working against you. And that brings us to the final, most powerful shift of all, the pattern of eating that consistently shows the strongest protection for the kidneys over time. By this point, a clear pattern starts to emerge. When fear is removed and biology leads the way, the kidneys respond better than expected. And that's where the most consistent evidence-backed strategy comes in: a plant-forward, minimally processed way of eating. Not a fad, not vegan dogma, a metabolic environment that gives the kidneys room to breathe. Across the largest kidney nutrition studies of the last decade, one finding keeps repeating itself. Diets centered on whole plant-dominant foods, vegetables, fruits, legumes, intact grains, nuts, seeds, are associated with slower CKD progression, lower phosphorus burden, better blood pressure control, and improved insulin sensitivity. Not because plants are magical, but because they remove what quietly destroys kidneys while adding what actively protects them. Think about the modern renal-friendly food landscape: low-protein cookies, processed breads labeled healthy, convenience meals engineered to meet numbers on paper while flooding the body with phosphate additives, sodium, and refined carbs. Patients follow the rules, yet inflammation rises, vessels stiffen, and kidney function keeps slipping. The diet looks safe, but the food system is hostile. Plant-forward eating flips that environment. Natural plant phosphorus is bound to phytates and absorbed at much lower rates than synthetic phosphates. Fiber feeds gut bacteria that convert nitrogen waste into less toxic compounds. Organic acids from plants help neutralize metabolic acidosis, reducing muscle breakdown and nephron stress. This isn't restriction, it's load reduction. I've watched patients experience this shift firsthand. One man told me, "I stopped eating less and started eating cleaner." Within months, his phosphorus normalized without binders. His A1C dropped. His energy returned. The only real change wasn't calories or macros. It was moving away from ultra-processed foods and toward recognizable ingredients. His kidneys finally stopped fighting his plate. This approach doesn't demand perfection. It prioritizes whole foods over products, ingredients, over labels, patterns, over micromanagement. It allows flexibility, including small amounts of animal protein when chosen intentionally, while keeping the foundation anti-inflammatory and phosphate light. That's why it works in the real world, not just in studies. Importantly, this isn't about eating less. It's about eating from a system that doesn't constantly provoke insulin spikes, oxidative stress, and vascular injury. When the dietary burden eases, medications work better. Blood pressure stabilizes. The kidneys shift from survival mode into maintenance mode. And here's the part most people miss. This way of eating doesn't just protect the kidneys, it protects independence. Muscle is preserved, energy improves, falls decrease, quality of life rises. That's the outcome patients actually care about. The core message becomes simple but powerful. You don't heal kidneys by shrinking your diet, you heal them by choosing a better food ecosystem. But before you assume this guarantees safety, there's one final truth that matters more than any food list. Because even the best dietary pattern can fail if you ignore the warning signs your body's already sending. And missing those signals can determine whether kidneys stabilize or cross a point of no return. Before we end, I want you to hear this clearly. You are not failing your kidneys. You were never lazy, careless, or undisciplined. Most people with kidney disease were simply given fear-based advice without context, and fear is a terrible long-term strategy for health. What actually protects your kidneys isn't perfection, it's understanding. Small, consistent changes, eating the right foods, watching your labs, asking the right questions, can dramatically change the trajectory of kidney disease. And yes, it is still worth doing no matter where you are today. If this video helped you see kidney nutrition more clearly, do yourself a favor and save it. Kidney health isn't something you fix once, it's something you revisit over time. Save this video so you can come back to it when you're shopping, when you're confused, or when fear starts creeping back in. And make sure you subscribe to the channel, because I share evidence-based kidney and metabolic health information that most people never hear in the clinic. No myths, no extremes, just science you can actually use. Most importantly, don't lose hope. I've seen kidney numbers stabilize. I've seen energy come back. I've seen people move away from dialysis instead of toward it, not because of miracle cures, but because they finally had the right strategy. Your kidneys are resilient, and when you support them correctly, they respond. Take care of yourself. Stay curious about your health, and remember, you're not alone in this journey. I'll see you in the next video.